Ready in 3, 2, 1. This is a demonstration of the G button change and use of the extension set. So the baby's G buttons typically get changed, or pediatric typically get changed every 3 months. Daily, you would be rotating this hub to avoid the skin adhesion to the G button. But to get ready for the change, I'm going to make sure that the kind of G button, size, and length matches the new one. In this case, it does not, but in the home, we would make sure that the brand, the size, and the length all match, and it matches the plan of care. Hand hygiene, donning gloves. I would have the syringe. In this case, this is a Luer-Lok syringe, but typically you want to keep the syringe that's used to inflate this balloon, as the typical slip-tip medication syringes don't fit. Just be aware that if you use a Luer-Lok, you wouldn't want to use this on the respiratory system until it's been washed to avoid cross-contamination. So I'd have my syringe ready. I'd open up my new kit. I would check the balloon. The balloons get filled with distilled water. However, in this case, I am only going to use air so I don't cause any mildewing of our supplies. So I fill my syringe with 4 mLs of distilled water. Test my new balloon. It should be symmetrical. If it's not symmetrical, I can manipulate the balloon and make it to get it symmetrical, deflate it, and keep my syringe attached. That way it just gives me more to hold on to when I'm inserting it. You can open up the flap. If the kit comes with the introducer, it looks like a little blue golf tee, you can insert the introducer and apply lubrication, putting it back into the tray to keep it clean. Getting the extension set ready, I would get my catheter tip syringe, tap water, or in this case it's an infant, so it would be infant water. Connecting it to the extension set, opening up the clamp, priming it with water, disconnect. And just to prepare the extension clamp, extension set, I would have it clamped so that when I put it on the baby, I'm not getting gastric contents coming up out of the extension set, and have that all ready. Coming over here, if there was a split gauze present on the baby, I would remove the split gauze. This is a 2 trained caregiver procedure when it is a scheduled procedure. The other trained caregiver can hold the baby, maybe hold the baby's arms or legs depending on how much of a wiggle worm they are, or do a holding hug to kind of hold the baby's arms and legs so that the baby isn't interfering with the change. Removing the split gauze, I take note, drainage, odor, and also assessing the stoma too as I change it. Using the syringe that hopefully came with this G button, deflate the balloon, lift it straight out. Be aware some gastric contents may come out at this point, so sometimes just plug in the hole. New one goes straight in, inflate the balloon, disconnect your syringe, remove the introducer, and now we need to check placement. So using the extension kit, in this case, I've turned, because I'm right-handed, I've turned the hub around so that the black line on the G button lines up with the black line on the extension kit. Holding the hub, I depress the extension kit into the hub, rotate it, still holding the hub because I don't want to pull on the baby. Give it a little tug and make sure that it's secure in there. We check placement. 2 ways to check placement is aspiration and auscultation. Aspiration is preferred when it's a G button. That way we're not introducing additional gas into their tummy and causing gastric upset. Open the clamp. I will withdraw, aspirate, and I would see some partially digested formula there. You know, looks just like baby spit up. And then I can flush to flush it back in if it's clamp again. If it's not time for the baby's feedings or meds or anything, I can, again, lining up the black line of the extension set with the G button, disconnect my extension kit, and then go wash my supplies. Do my G-button care and replace the split gauze as needed. And that's the demonstration of the G-button change and extension use on a baby.